State health officials say staff at a Southeast Portland long-term care facility failed to control the spread of COVID-19. There are now 50 confirmed cases of the virus connected to health care at Foster Creek, and 14 residents have died. Fox 12's Camilla Ortiz joins us live tonight with what action the state is now taking. Camilla.
Well, Liz, the Department of Human Services detailed some disturbing observations in its order for Foster Creek, things assessors took note of late last week. Now the facility will be getting some extra oversight to make sure staff and residents stay safe. According to DHS, 24 long-term or assisted living facilities in Oregon have reported coronavirus cases in staff or residents. Statewide, that's only 4%. But what's concerning is the impact on the vulnerable populations inside the facilities.
While less than 20% of individuals with COVID positive are in long-term facilities, we now are aware that over half of the fatalities are occurring in those facilities.
Steve Allen with the Oregon Health Authority said the state was notified in late March of an outbreak at healthcare at Foster Creek. That's located near 136th Avenue in Southeast Foster. 3 cases were reported there in late March. Now there's 50.
When we discovered that the facility was not adhering to those infection control guidance, we believe that the residents at that facility were being placed at an unacceptable level of risk.
DHS intervened, giving guidance, restructuring management, and transferring 20 residents to the hospital. Officials said assessors went back again last week, and according to the state order, here's what they saw. On April 10th, staff were reportedly observed not washing their hands after taking off or touching their masks, working across units wearing the same PPE, and officials said no housekeeping was happening between the hours of 7 p.m. and 6 a.m. On April 11th, assessors observed staff not getting screened before entering the building and not washing their hands between resident visits. I asked officials to talk about these violations today.
Can we not talk about what some of those observations are and the implications of them?
Camilla, my answer to that question is the documents out there. The bullet points are out there. At this point, I'd much rather spend our time talking about other questions because this is a public document.
Now, as a result of this newer round of observations, DHS issued a license condition order. So what that does, it appointed a consultant to help with day-to-day operations there at the facility. It also requires healthcare at Foster Creek to immediately start COVID-19 training for staff, and it requires the facility to provide weekly updates to the state. I did reach out to healthcare at Foster Creek today, but did not get a response. Reporting live in Beaverton, Camilla Ortiz, Fox 12 Oregon.